so huge words. Actually, you'll make my sleep more peaceful tonight, having heard so much about me. And it was blissful to meet Rekha. Nice meeting you. For the first time, I met this lovely champion of Uttarakhand. I was missing anybody from Uttarakhand. So I had a lot of promises with her, and big congratulations to Dr. Ramchandani. You made proud of us and all your friends to seeing all of them in front of you. So I think it's a very pleasant and the blissful day. Ending days is the wonderful. I think maybe Manoj brings more excitement, but it was very soothing time. And throughout the meeting, I was sitting next to Sujoy. That was another best thing. So good vibes were getting transmitted. Coming to the type 1 diabetes and CBD. So they are 2 to 5 times had the risk of mortality, and age is just they develop the events 10 to 15 years earlier, and incidence of CVD is approximately 1 to 2 per year. So there is a huge risk, and I'll share a small. So there are a lot of data and showing that the morbidity and mortality in type 1 disease diabetes is more, and it is little more in females. And I'll share you a DCCT story, Diabetes Control and Complication Trial. Actually, this year coordinates in 1993. The results came in 93, and I started doing my endocrinology work in Kanpur. And at that point of time, people are asking me, what is new? And I very proudly said, now with good control, you can reverse the complication of diabetes. So this was the DCCT, and we have now more than 30 years of follow-up of type 1 diabetes. And what we have observed that if we control it nicely, we can do a lot. I'll be sharing very quickly. And if you look, the type 1 diabetes, a lot of things are there. The hyperglycemia is there. As time passes, the lipids are there. I think the hypertension adds, double diabetes, obesity, insulin resistance. Then the smoking, alcohol is not there, excessive alcohol, socioeconomic factors. Uh, Madam Rekha has then genetic familial renal disease, the familial risk of cardiovascular atherosclerotic diseases, and this all ripens over the years and decades and leads to subclinical cardiovascular disease, which eventually matures into clinical cardiovascular disease. So this is an entire story, but I'm seeing all my type 1 friends, they are all thin and doing well. And I'll not be going to mechanism. A lot of mechanisms are there, but what is important is that if heart is there, there is a hyperglycemia induced problem, hypertension, blood pressure. I think we have all narrated, and these are all the risk factors. And what is two things are there? One is inactivity, another is the psychological factors. Diet is another part, and with the exposure of diet we have. The risk assessment is there. There's many calculators, you can use them. This is the trial. If you what I shared with you, diabetes control and complication trial. It has two arms, the conventional arm and the intensive arm. Initially, if you look at this, the control, when trial is stopped, the conventional and the control arms, the A1C became same, less than 7 and more than 9. And after 10 years, and then they were followed for 30 years. And what was observed that the intensive arm, which had an A1C equivalent to conventional arm, experienced a 57% reduction in long-term cardiovascular events. So this was, I mean, even the control is not very. So that is another thing. If those who are newly detected diabetic, if we work hard with them and maintain their control right from the beginning, we can do a lot. This is another. Now look at the uncontrolled diabetes. So what is observed if the diabetes is uncontrolled, the risk of developing cardiovascular disease is almost 3 times compared to good control. So control every time matters a lot. I tried to look at the Indian data, CV risk profile for Indian young adults with type 1 diabetes compared to general population. This was the data from Dr. V. Mohan, Nikhil Tandon, and took data from ICMR registry of type 1 diabetes more than 20 years. Indian with T1D had lower levels of BMI, festive ratio, favorable lipid profile. So this was something different, that relatively low prevalence of CVD risk factors compared to general population. But it was a one-time study. But if we, I'm sure, if you have a long-term follow-up, probably will be able to see much more. And management-wise, healthy diet, physical activity, smoking cessation and alcohol control is actually very, very important. Now we can think in terms of SGLT2 and GLP-1 receptor agonists we have been talking, and antihypertensives of choice, antioxidants plus minor role, antiplatelet or aspirin, those who are having family history of cardiovascular disease, then lipid lowering agents. And then Partha was talking about CGM and all this. So I think if we use technology from day one, probably we have justified it. Statin, I think I'll come to uh, directly the SPAT guidelines. Look at the bottom. Any diabetic after 10 years of age, if LDL is more than 130, give 3 months of lifestyle. If it doesn't come, then give statins. So that is what. So statin should be used, and I'm seeing a lot of patients they are not using statins. And so finally, quit smoking, control weight, physical activity, diet, control your cholesterol. I think as a primary prevention, cholesterol lowering, but blood pressure is often missed, and blood glucose is often missed, because life is not all that rosy. These type 1, they come and then in 30 minutes, they come and then they disappear maybe for months or years together, and then they come back with a lot many complications. And majority of them come with the very high blood pressure, impaired CKD, retinopathy, and eventually they land into cardiovascular problems. So with this, I think, thank you so much. And all of you are invited in this type 1 meeting. This is the meet dedicated to type 1 caregivers. So all physicians, endocrinologists, family physicians, pediatric endocrinologists, whosoever is taking care, all educators, all dietitians, all our T1D advocates are invited 5th, 6th, 7th. So all of you have very warm welcome. Thank you so much.